Well, you have heard of mammograms and colonoscopies, but all of those are two very important screenings in the early detection of cancer. But what about a lung screening? They're fairly new, so people don't really know about it that much. But Brooke spoke to one woman who said it saved her life.
When I went to the doctor and she told me that I was eligible for a lung screen, I jumped on it because I was a longtime smoker.
Terry Rumpf doesn't smoke anymore. She quit last year after 45 years, but worried the damage was already done.
It runs in my family.
And with her history, she knew the odds. About 19 out of 20 lung cancers are smoking related. Terry started screening for it 3 years ago. It's a simple CT scan that takes seconds to complete.
I thought that it was something I should take advantage of.
And she's glad she did. While she showed no signs of cancer, recent scans found 2 separate tumors on Terry's lungs, both in the early stages. Had she not gone through with the test,
I would probably still be sitting here not having any idea that I had cancer.
Norton Cancer Institute's Dr. Adam Lai says you have close to an 80% chance of catching cancer early when you screen on an annual basis.
That's a stage where we can remove it or resect it surgically. And most of the time, you don't need anything else. You don't need chemo. You're hopefully cured.
Most lung cancer patients aren't so lucky. They go without symptoms for months, if not years, before they're diagnosed, and then it's already spread. Kentucky ranks highest for the number of cases and lung cancer deaths. Indiana not far behind. People most affected are between 60 and 80 years old, though Dr. Lai says he's diagnosing some in their 20s and 30s. The more encouraging news is Americans are surviving the disease. Right now, the national 5-year survival rate 22.6%, about a 13% improvement over the last 5 years.
Getting lung cancer screening is really essential.
And Kentucky has one of the highest rates for screening and prevention. Still, less than 12% of those who qualify are screened for lung cancer. So who's eligible? Any current or recent smoker. You must be asymptomatic, aged 55 to 80 years old, and have a 30-pack a year smoking history. And if you're wondering if you should get tested, Terry has this to say.
Don't let the stigma of having been a smoker keep you from going in for this test. Nobody deserves cancer, and everybody deserves an opportunity to get healthy again.
In Louisville, Brooke Hash, WHAS 11 News.